Hey everyone, it's Andrea. So now we're going to get started with part 5 of our lecture for week 6. And the first article that we're going to start with is the Chapman et al. 2005. So initially they start talking about traumatic brain injury, and there has been a significant rise of children sustaining traumatic brain injuries. And so therefore, because there has been the significant rise in children with traumatic brain injury, it's crucial that we come up with a treatment that will be effective in teaching tools and strategies to these individuals, because individuals with TBI also have long-term impairments such as skill deficits and verbal impairments that require a specialized kind of treatment that's effective for this population. Because as I believe one of the articles we read earlier in our lectures, this population may learn slightly differently than individuals diagnosed with autism or developmental disabilities. And so precision teaching is an effective tool that can make performance-based decisions. And once again, we did talk about precision teaching earlier in the lecture. And it's a combination of different teaching tools and methods that specifically work on error correction and immediate feedback. And then they look at one of the characterizing traits of precision teaching is that they use standard acceleration charts and they measure fluency of response during precision teaching. There are 4 basic principles. The first one is that the learner knows best, so it's very individualized and we pace it based on the learner's needs and not what us as teachers feel that we should be doing. And then also the behavior must be directly observable. So we don't use precision teaching for a behavior that we can't observe, such as thinking, etc. And then another characteristic of precision teaching is that the frequency is the most effective and useful measurement in the performance, which we've already talked about. We talked about how we measure with standard acceleration charts, and they take frequency divided by time, and you get fluency of rate. And then the data are recorded on a standard acceleration chart. And the fluency is the performance measure that refers to the speed and accuracy of the responding. So we're going to go through the participants of the study. The first participant, I thought this study was pretty interesting to see how all of the individuals sustained traumatic brain injury, and it's kind of an eye-opener of all of the dangerous things that we kind of do in our lives, and we don't really think of how it could affect our health. And with some of the risky behaviors, you kind of want to keep an eye out of making sure that you're wearing a helmet when riding a motorcycle, or even wearing a helmet when riding a bike. But that's a side note. So these participants, the first one was a 13-year-old female diagnosed with traumatic brain injury. And she got traumatic brain injury from, she was a passenger in a car accident that hit a tree head on. The second participant was a 19-year-old male, also diagnosed with traumatic brain injury, and he suffered from an accidental self-inflicted gun wound. So he accidentally shot himself in the head. They said it went from temple to temple, so he shot himself through his head. And they found him unconscious and rushed him to the hospital when they found him. And then the third participant is a 13-year-old female with traumatic brain injury who was struck in the head with a golf club, and she lost consciousness. And then when she woke up, she was showing nausea, and they immediately rushed her to the hospital, and she ended up having long-term impairment as a result. The fourth participant was an 11-year-old male with a anoxic injury secondary to seizure disorder and cerebral palsy. And then the fifth participant was a 17-year-old male with traumatic brain injury as the result of a football injury. If you remember the article that we read earlier and a couple of weeks ago about tackling with football, this individual suffered from traumatic brain injury after being tackled twice without wearing any type of protective gear. So it is very important to understand how to effectively tackle, and maybe using that type of article to football teams, we can help prevent these types of injuries from occurring. So what they did is they used a multiple baseline design across participants, and the setting was a school within a post-acute residential neurorehabilitation program. Training materials included flashcards and then SAFMEDs, which we had talked about earlier. And a more clear definition of SAFMEDs is to say all fast, minute each day shuffled. And so basically with the SAFMEDs, you're trying to say them as quickly as you can, usually timed at for 60 seconds. How many SAFMEDs can you get through within 60 seconds? And the idea is that you want to beat the time that you had the day before, and your fluency increases. So then they also used puzzles, writing materials, math sheets, and reading materials to teach these new skills. And all of these skills were chosen specifically to what the individual participant would benefit from with their own program. They did use an interdisciplinary clinical team that consisted of an OT, occupational therapist, a PT, and a speech-language pathologist. They also had a special education teacher and a behavior analyst. And prior to, or when these individuals first come to the facility, all of these people already conduct a bunch of different types of assessments on them, so they're able to see what their skill levels are and the extent that their injury affects their overall behavior. So then they did baseline, and during baseline, each participant was given their individual task, and then they received no feedback for their performance. So how quickly were they able to get through the flashcards, or how quickly one individual was working on using a walker, so how quickly could he stand up and sit down within a certain time. And then they did probes where each participant was taught the skill designed for them, and then they were timed on how quickly they could engage with that skill. With traumatic brain injury, there's not really a standard fluency for goals for individuals, and so instead they set up the target to be at 75% above their baseline. So basically, we don't know how quickly somebody with traumatic brain injury would be able to get through an amount of flashcards, so we're not going to set a goal without knowing the standard for this type of population. So they decided to let's at least see if we can increase that 75% of their maximum output. And during the study, they used two types of reinforcement contingencies. The first one was a brag board, and this is where they had the target behaviors and the scores listed on the brag board. And if they achieved a higher score than the day before, they were able to draw a prize ticket and redeem it for specific prizes that they had set predetermined prior to the study. And then the second contingency was the individual who had made the most performance between Monday through Thursday out of everyone got to do a very special fun activity on Friday during their normal scheduled time instead of doing the intervention. So during treatment, all participants were advised on the importance of increasing speed and accuracy, as well as the reinforcement contingencies associated with their performance. And they all used a variety of methods and charted their progress on a standard acceleration chart. The researchers collected IOA and demonstrated 100% agreement across all sessions, and all 5 participants did show significant improvement from fluency training intervention. So this is one of the second articles that we've read this week that demonstrates that fluency training is effective. If you remember the first article earlier in the lectures with increasing on task and increasing fluency with the little boy who had ADHD, and now we can see that this is also effective in increasing fluency with individuals with traumatic brain injury. And one thing that they did note also, just anecdotally, is they noticed that the individuals appeared as if they had a better sense of well-being and better levels of self-esteem. And they said that all participants displayed increased self-esteem and satisfaction. And this is important because individuals with traumatic brain injury often report feelings of being less of a person. Personally, when I have worked with individuals who have traumatic brain injury, especially with individuals who have short-term memory loss, I've noticed that one guy in particular, every time he saw me, he would ask me what my name was, but you could tell that he was really sad, and he would say, "I'm so sorry, I have to ask you again, what's your name?" And then I would tell him, but his overall demeanor was just pretty kind of sad, and he almost appeared a little embarrassed that he had to ask me my name every time I saw him. And I did see this individual 2 or 3 times a week. So just personally, I have noticed that these individuals do suffer a little more from lower self-esteem and depression, just because they are aware of their injury, and they are aware of the deficits, and they try to work really hard and don't always find a lot of success. So this shows that this is a treatment that does provide success with these individuals, and it's even better that we get higher levels of self-esteem as a result. What's also nice about this is they can see their results immediately after it occurs. So with the daily plotting, you're constantly watching your own data, so you're constantly seeing how much you're improving every day, and everybody that immediate feedback is also nice. You don't have to wait to see, I'm sure if you have to wait and see what your grade is 3 weeks later, it's not as effective as if you find out what your grade is as soon as you took the test. And the other thing they noticed is as the participants saw their scores increase, they did gain confidence in themselves and in their abilities. And so it adds in a little more of a establishing operation or an MO to want to beat your score for the next week. So there's that added contingency of trying to beat your score and seeing your progress that you can beat your score. So we're going to move on to our next article. It's the ICASETH 2013. And I'll go ahead and pull this up. So ICASETH 2013 is an analysis of verbal stimulus control and interverbal behavior. And it talks about the implications for practice and applied research. So this article is more of an essay that describes the implications for practice and applied research, and it's not necessarily an experimental study, but it's nice to read through it and see how the different pros and cons of the different types of verbal stimulus control with interverbal behavior. So overall, interverbal behavior occurs when verbal stimuli evoke a verbal response that is different from the antecedent stimulus, in that there is no point-to-point correspondence. So basically what this means, if I say, "Where's the sun?" and then you say, "In the sky," that's an interverbal. I asked you a question and you responded, and there's no point-to-point correspondence with it. But I serve as a verbal stimuli for you to provide a verbal response. So I serve as the speaker, you serve as the listener, and then you become the speaker and I become the listener. So another example is if I said, "What do you eat for breakfast?" and you say cereal, that would be an example of interverbal response. And the reason it has no point-to-point correspondence is because it's not imitative and it's not echoic. So if I said drink and you said drink, then that would have that point-to-point correspondence. So that's the difference between having point-to-point correspondence, where the word is the exact same all the way through, so point-to-point, it corresponds, versus an interverbal that does not have point-to-point correspondence because it's completely different words. So several studies have investigated interverbals and found that children fail to acquire more complex interverbal relations. And these difficulties in learning may be related to the fact that the primary antecedent variable for most interverbal behavior involves complex verbal stimulus control. So overall, the purpose of this article was to provide an analysis of the type of antecedent control involved in interverbal behaviors typically taught to individuals with developmental disabilities and language delays. So there are 3 types of stimulus control. The first one is a discriminated operant, otherwise known as discriminative stimulant, or the SD. And a discriminated operant occurs when a response-consequence relation comes under the control of a third element called the SD. So the SD is the stimulus that precedes a particular response, and it correlates with reinforcement. So typically when the SD is present, it signals the availability of the reinforcement. And then the second type of stimulus control is a conditional discrimination. Conditional discriminations involve a 4-term unit that was developed by Sidman in 2000, and this is because the discriminated operant, so the 3-term unit, comes under contextual control, hence in a conditional discrimination. So whether a particular stimulus functions as an SD or an SD, I think it's supposed to say S delta, is a stimulus. Anyways, it depends on another stimulus, the conditional stimulus. So for example, when the conditional stimulus A1 is presented, the antecedent stimulus for the 3-term unit, for example B1, takes on the function of an SD, and stimulus B2 takes on the function of an SD. Conversely, when A2 is presented as the conditional stimulus, stimulus B2 takes on the function of the SD, and stimulus B1 takes on the function of the SD. Hence, in conditional discriminations, the conditional stimulus determines the function of the antecedent stimulus in a discriminated operant. We're going to go into this and have some actual examples of this later on in the lecture. The third type is compound stimuli, and a compound stimuli in a discriminated operant exists when a particular response is controlled by 2 or more stimuli, or 2 or more elements of a stimulus. So that is, the SD involves several elements, or there are several SDs that together evoke a particular response correlating with reinforcement. So 2 or more stimuli refers to stimuli that are in some way topographically distinct, so that means they don't look the same. And 2 or more stimulus elements means components of a stimulus that could include abstract qualities such as shape and color. And there are many examples of compound stimulus control in interverbal behavior. So stimulus control by compound stimuli in an interverbal relation occurs when 2 or more verbal stimuli, so for example, big and animal, come together to evoke a particular response, such as elephant. Another example is when the compound SD, red fruit, is followed by the response tomato. Also responding to the question, what do you eat that's red? Involves compound stimuli because a correct response requires that the speaker's behavior come under control of several verbal stimuli, most notably eat and red. And the same is the case for the question, name a big animal. You could name elephant, giraffe, horse, etc. So discriminating verbal stimuli of different complexities is a prerequisite for learning complex interverbal behavior, and this is going to be kind of the focus of the current paper. In addition, however, learning complex interverbal behavior involves complex verbal topographies, such as saying, the capital of Norway is Oslo, in response to the question, what is the capital of Norway? Or in the example mentioned above, describing Einstein's law of relativity, or singing Beethoven's Fifth. So consequently, interverbal behavior involves both the discrimination of complex verbal stimuli and the production of complex verbal responses. Both likely contribute to the difficulty many learners have in acquiring complex interverbal behavior. So it's important to understand the stimuli that comes before the interverbal behavior in order to be able to understand it. So discriminated operants are a basic form of listener behavior that is to respond to simple instructions such as clap hands or jump. So if I look at you and I say, show me how you clap, then I would wait for your response, clap. And that is that's an example of a discriminated operant. So they are they have the understanding that I have provided the SD, which is show me how you clap, and now I have signaled the availability of reinforcement because in the presence of that SD, previously they have received reinforcement. So now this individual knows this, Andrea has said, show me how you clap in the past. That has provided the opportunity for reinforcement. So now I'm going to go ahead and clap because there is that signal that I might have the opportunity for reinforcement. And then with conditional discriminations, listener behavior involving conditional discriminations has been described as mandated stimulus selection. Typically, and for several reasons, receptive labels are more difficult to learn as compared to learning to clap and wave in response to hearing the instruction clap and wave. So the most basic form of receptive labels is when the learner identifies a particular object in response to hearing its name. So let's say, for example, I have random Clorox wipes sitting on this desk, and I have a stapler, and I have a little mint. So I have these 3 items. Let's just do 2 for sakes. And I'm going to say, find the stapler. You point to the stapler, that's an example of a conditional discrimination because you're able to discriminate that this is not a stapler because this is the Clorox wipes and this is a stapler. So I've demonstrated that the discrimination between the two. So then let's say I remove the stapler and I have a new thing, and you know that this wasn't a stapler. You don't know what this new thing is, but it's going to be one of the two. When I say find the Clorox wipes, so I'm going to teach you how to find the Clorox wipes. Now you know that this is Clorox wipes and this isn't, well, you don't know this is a mint yet, but you know that you can discriminate that this is the one that you want. So that was the most basic form of receptive label, is just receptively identifying the different item in an array, typically an array of other items, anywhere between 2 and 3. Sometimes we want to teach more complex discriminations between an array of 8 or 10. And then an example of the last one is compound stimuli. And so this is an important step, is to teach the learner to select items that require him or her to discriminate 2 stimuli or stimulus elements, such as selecting the red car based on the instruction, give me the red car. So let's say for here, I just so happen to have 2 different types of vitamin water. So I'm going to ask the kid to find the purple vitamin water, and then that would be an example of a compound stimuli because it's still the same item. They're both vitamin water, but this one just happens to be purple and this one happens to be black. So they have discriminative stimuli within, you can see. They're the same stimuli, it's just 2 different colors. And then the last one they talk about in the article is speaker behavior, and concurrently with teacher listening skills, complex verbal responses may be established while keeping the antecedent stimuli as simple as possible. And this can be done by using vocal imitation to teach echoic behavior. And echoic verbal operants may subsequently be brought into other verbal operant classes by changing the stimulus control of the verbal operants, such as when learning tax and interverbal behavior, or by manipulating establishing operations and reinforcement contingencies to establish mands. So overall, the programs outlined above are logically and conceptually parsimonious, but as far as we know, there's no empirical research to support the notion that teacher-listener skills, as described above, facilitates learning of complex interverbal behavior. So as a result, future studies should look into this. Okay, we're going to move on to our next article, which is the Gardner et al. In 1994. Let me grab it. Okay. So Gardner et al. Looked at the effects of response cards on student participation and academic achievement in a systematic replication with inner city students during whole class science instruction. So overall, most classroom activities allow for students to be passive observers. And actually, if you look into the literature, I've done a little bit of research on the difference between active versus passive learning. And the overall educational literature suggests that they actually have a hard time discriminating which one is going to be a better form of teaching, but overall it appears as if active teaching is more effective than passive teaching, because you're engaging the students in this higher level learning instead of having them sit there and watching a lecture. Half the time they're on Facebook, half the time they're scrolling through Pinterest, a majority of the time they're not paying attention to the lecture. So by using some type of interactive teaching style, you're engaging the students more often, and it kind of serves as that motivation to engage in the higher level learning if you're more actively involved in the type of teaching. So that's just a side note, but if you ever go forward and become teachers your own, just kind of know interactive activities are usually a little more fun than just doing lecture. Some of the pros and cons of lecture is that it is typically easier. If you did the active hands-on stuff, it takes a little more prep for class. And to go to the article, one of the most commonly used methods of whole class instruction is lecture by the teacher, which we talked about. And one reason why lecture is probably ineffective is that there's not really opportunities to respond. So typically, if you're in a lecture setting, the teacher will do they'll say, hey, what do you think about this? Or what do you think about that? Majority of the time, you usually are responded with the sound of crickets in the room, and either students are too scared to answer the question, students don't know the correct answer, or students just weren't paying attention, so they may not even know what you asked them. And so it's just this awkward silence while you wait for a response. So what they found as a common strategy used by teachers for generating student participation during whole class instruction is to pose a question, which we talked about. And then, one of the other cons about it is, so typically if you do have somebody who is going to respond, it's usually the same person who responds every time, or a high achieving student who responds. So you have the one student who's always providing the answer, which then possibly makes the other students feel even a little more inadequate or a little more fearful to provide that answer. Or it's, if so-and-so is going to answer all the questions, even more time for me to be on Pinterest or Facebook. So the present study was designed as a systematic replication of a study by Narayan et al. 1990, and they sought to extend the findings of the earlier study by A, increasing time between instruction and quiz to determine if the positive effects of response cards found in the earlier study could be extended to the next school day. So were these individuals able to maintain these skills over a period of 24 hours? And then they also extended it by administering biweekly review tests to determine if any differential effects on achievement would be maintained. And then third, they analyzed student performance on recall and recognition and test questions. And the way they did this, I skipped over a little part of my notes, is they used response cards. And response cards are basically just reusable signs or cards that the students can hold up simultaneously, and the teacher will scan the room and look at each student's responses. And if every student gets the correct answer, then the teacher will provide feedback to the entire class. But if some of the students are getting the correct answer and some aren't, then the teacher will provide feedback saying, oh, hey, great job. The answer is, whatever that answer may be. And then that's kind of a prompt to the students who got it incorrect, because they are getting that immediate error correction feedback. So the purpose of this current study was to compare the effects of hand raising and response cards on A, the frequency of active student responding during instruction, B, the accuracy of student responses during instruction, C, student performance on next day quizzes and biweekly review tests, and then D, student performance on recall and recognition test questions. They also assessed which method of responded the student preferred, and they did this through a 2-question questionnaire, basically saying which one did you prefer. So this study took place in a 5th grade classroom in an elementary school located in a low SES area of a large Midwestern city. And there were 13 boys and 11 girls in the class, ranging from ages 10 to 12. They looked at 5 dependent variables. The first one is A, teacher presentation. Then they looked at number of student responses, accuracy of student responses, next day quiz scores, and biweekly review test scores. And then, of course, they also looked at the students' responses to the 2-question interview on which one they preferred. So for the next day quiz scores, beginning the session 2, a 16-question quiz was administered at the start of each session. The quizzes tested students on science concepts and facts from the most recent session. And then review test consisted of a 40-question review test that was given every 2 weeks during the study. And each of the 4 review tests covered an equal amount of material selected randomly from each of the 6 to 9 lessons conducted during the preceding 2 weeks. They collected IOA, and agreement ranged from 94 to 100%. They used an AB-AB reversal design to analyze the effects of both experimental conditions. And so then during the hand-raising sessions, the teacher was expected to wait for 3 seconds after asking a question before calling upon an individual whose hand was raised, I guess to provide opportunity for everyone to be able to raise their hand. And then with the response cards, they did the same protocol that I had described earlier, where they scanned everybody's responses and either provided corrective feedback for those who didn't have the correct answer, or they provided praise for the entire classroom if everybody had the correct answer. So let's go ahead and look at the graph and the results. So here you can see the open circles are the hand raises and the closed circles are the academic responses. And across all 4 students, they did an alternating treatment, a reversal design. And you have hand raising 1, response card 1, hand raising 2, response card 2. And so during the hand-raising session, you can see hand-raising phase, the response cards are relatively low, and the responses are relatively low for the responses are relatively low. The hand raises, the academic responses are relatively low, and the hand raises are variable. And then when you look at the response card session, you can see that the academic responses actually significantly increase compared to just the hand raising sessions. So students are doing better when they have the opportunity to respond versus when only 1 or 2 students respond on their own. So overall, this study replicated the findings of Narayan et al. 1990 in that the response cards increased the frequency of active student responses during the whole class instruction, and they also improved the student scores on quizzes over the instructed content, and a majority of the students did anecdotally report that they preferred the response cards over hand raising. So something to note if you're in a classroom working with active student learning, that